It's great to see all of you here, and all of these discussions I will share not only with our leadership that has been in DC this week, but also with our co-sponsors on how to take some really practical steps to move it forward. Just a few background words on where we're at in terms of specifically financing in the global HIV response. There is this misnomer that the vast majority of funding for HIV actually comes exclusively from PEPFAR and from the Global Fund. The vast majority of international funding for HIV comes from PEPFAR and from the Global Fund. But well over 50% of all the funding for HIV in low and middle income countries actually come from domestic governments themselves. And now in this new, we're not quite in a post-COVID period, but as we move from the experience of COVID, we're seeing that the fiscal space for low and middle income countries is increasingly tight. And actually, in partnership with PEPFAR, the US Treasury, the Global Fund, UNAIDS, we convened a really interesting discussion yesterday at the IMF with 12 ministers / ministries of finance at very senior levels, ministers in the room from sub-Saharan Africa on specifically the sustainability of HIV funding in sub-Saharan Africa. And I was particularly struck, without pointing any fingers as to who said what, there was a very high level of commitment by the ministers of finance on the importance of sustaining and increasing and enhancing financing for HIV, but there was a very mixed, in some cases, quite a low level of sophistication on how much they're actually funding themselves on HIV domestically, and what are the practical steps, and how can they work with blended financing tools and with private sector partners on filling the large and growing gaps we have on HIV financing to really get to sustainability roadmaps. That's why UNAIDS worked with Economist Impact earlier this week. Some of you were at the launch that we did of a report called The Triple Dividend. And this really looks at not only what's the impact of HIV financing for HIV, but what are the positive spillover effects of HIV financing for health more generally, for health system strengthening, for social and economic development, with some projections between now and 2030 on what does optimal HIV financing look like for generating positive spillover effects for, I think it was 13 economies in sub-Saharan Africa across the board, and not just for HIV outcomes. So we're, as UNAIDS, we're very focused on not only supporting work to end AIDS as a public health threat by 2030 and working with all partners to do that, but also on how do you close the gap for financing. And as Mike said earlier, and I've heard say several colleagues here say today, we're not going to close that gap only by looking or trying to squeeze more juice out of the same partners, the same donors, even the same governments. I think the partner governments can do more, but they're looking for partnership and expertise, including on blended financing models, to take it forward. Particularly on women's health, it's no surprise that HIV continues to disproportionately affect adolescent girls and young women, particularly in sub-Saharan Africa, for a combination of reasons that we all know. And there's a lot more work that needs to be done, as other colleagues have already mentioned, on really urgently scaling up the work on not only HIV prevention for adolescent girls and young women, but also the other related health risks, including cervical cancer. There is an amazing Go Further initiative that we work on with PEPFAR and the Bush Institute, but there's much more work that needs to be done to protect adolescent girls and young women in sub-Saharan Africa, particularly from HIV and from cervical cancer. I'll stop there just by two quick points. One is that Joanne, you and I have discussed over the last few months, UNAIDS is happy to join the Women's Health and Innovation Network and really take some practical steps in the next few months on how we can contribute to the work, particularly in sub-Saharan Africa, on moving forward blended finance and new funding initiatives to really help close some of these gaps. And then finally, I'm probably not well qualified to tweak African proverbs, but we've all heard the African proverb about, if you want to go fast, you go alone. If you want to go far, you go together. But we're, at least in HIV, we're in this strange space now where we need to go fast and we need to go far and we need to go together. So we're really looking forward to working with all of you to take some of those next steps. Thanks.